For more than a decade, Holtorf Medical Group has been helping people with complex illnesses and hormonal imbalances that typical therapies were not able to resolve. The doctors at Holtorf Medical Group combine passion and commitment with cutting-edge testing and therapies to help patients that have not been helped elsewhere.
We really see a wide range of patients. Everything from the patient who is I'm just more fatigued than I've usually been, which is not myself, or can't lose weight, to perimenopause, menopausal patients that come in for bioidentical hormones, to the severely ill that haven't been able to get any improvement, seeing 10, 20 doctors from all around the country, all over the world, and multi-system illness, chronic fatigue syndrome, fibromyalgia. They've tried just about everything. They've almost given up, and were successful the overwhelming majority of time with those patients.
It's been very exciting to see and meet these people and treat them for conditions that they haven't often got help.
I felt over the years that I was slipping. I felt that 3 o'clock in the morning, that was it. I was done sleeping. I noticed that I was having a lack of energy, kind of loss of libido, just all of the things that I would hear about and read about as you get older. I went to my doctor and I told him what I was feeling, and he said, "Claudia, that's natural at your age." Ooh, I wanted to kill him. I said, "Oh, at my age, it's natural." So when my doctor was kind of arguing with me that I should just accept the fact this was part of getting older, that's when I thought, okay, I'm going to go another route. And so I went to the Holtorf group. I felt like they understood me. They knew what I was going through, and they told me that I didn't have to live with it. They told me that they could really improve the quality of my life, and it has.
It's very, very satisfying when a patient comes to you and says, "I have this going on," and then we take all that information, get the appropriate lab studies, and put together a treatment plan based on that, even if it's a little different than what their last 4 primary care doctors would have done. Here we have more options.
When patients come in, they fill out an extensive questionnaire, and that allows us to look at all the different symptoms that may not have been addressed in years and years, and so we can really take a look, and it gives us clues to what's going on physiologically, because oftentimes these are all connected. And doctors will typically look at one symptom and say, well, I have a medication for that. But as you talk further with the patient and dig deeper, all these are connected. The fatigue associated with the depression, with the inability to lose weight, thyroid problem, or they may have low estrogen or low progesterone causing anxiety, low testosterone causing low libido. So we can look at all these interconnections, and that gives us the clue on the first visit.
Before, when I had gone about my weight, the weight was the total focus and nothing else. And that hasn't been the case here. And I've lost about 70 pounds.
And the nature of our patients, a lot of our patients, chronic fatigue fibromyalgia, which is a multi-system disease, when they go to a regular physician, they'll tend to sort of focus on, one problem. If they go to a gastroenterologist, that's your problem, it's your gut, and they ignore everything else. What we try to do is we try to incorporate treatment into all the different systems that are affected.
He took me seriously about my symptoms and was willing to, help me out and not just say, oh, it's in your head kind of a thing.
I was surprised with how much time he spent with me. I spent somewhere between 2 and 3 hours the first time I was here.
We really are very evidence-based. We're looking for cutting-edge treatments. We do many tests that other doctors, their primary care, their internal medicine endocrinologists have never heard of, to really try to find the cause of the symptoms and the root of the problem, rather just say, here's an antidepressant or a medication to cover up the symptoms.
Various analyses that have been performed on me have created a comprehensive roadmap to wellness and health. You're all of a sudden feeling better about yourself, you have more energy than you've ever had before, and you're able to do things and accomplish things you never dreamed possible.
One thing that we were encouraged to do here is look for different ways to help patients.
He looks at what, the extra things that you can do with medications that other doctors don't do.
We review massive amounts of medical literature. We do more continuing medical education our doctors do in a week than most doctors do in a year.
They think outside the box. They do not just go with the traditional old-fashioned tests that don't often show what's going on. They are so up on their research.
For a year and a half, 2 different endocrinologists, and it was just, they just left me flat. I went in for the blood work, and they said, I'll see you in 3 months after the blood work comes back, and I did not feel any better. And the doctor essentially told me, well, I'm sorry you don't feel any better, but the blood work shows that that's the right level of synthroid for you, and I'll see you in 6 months.
It starts with a very thorough diagnostic examination that looks at blood work in non-traditional ways. A lot of the blood work I've had over my lifetime would say that if you're in the range between this and this, that if you come in somewhere in that range, that everything's fine.
It's not necessarily good to be in the range. It's what you're hoping for is to be optimal in terms of hormone replacement, and that's what we strive to do here.
It looked like they treated things very differently than traditional doctors, so I immediately made an appointment. And within 5 minutes, I knew I struck gold. I just started tearing up just knowing that, oh my God, he has a clue. And he immediately looked at me, asked me a few questions, and said, oh, I have no doubt you have hypothyroidism. The standard tests just do not always show that, so we need to do different tests. I was also diagnosed with chronic fatigue and fibromyalgia, and all those symptoms started improving.
Our outcomes were published and peer-reviewed. Patients saw on average 7.2 physicians without getting improvement came here. 90% of patients had significant improvement by the 4th visit.
They want the patients to be informed here. I put my trust in them and I went for it, and that's what really cured me.
He really has a better understanding of what's wrong with you and how to completely treat you.
We're dictated by what is best for the patient. We're there for the patient.
If you're not feeling well and your regular doctor or specialist cannot give you a diagnosis or cannot adequately treat your symptoms, the doctors at Holtorf Medical Group can get to the root of the problem to help you start living a healthy, vibrant life again.